Welcome. Welcome, everyone. We're waiting a few minutes as everybody arrives. Thank you for joining us for our webinar. Excited to present today and talk about speech-language pathologist for Better Hearing and Speech Month. It's May, and in May since the 1920s. We've been celebrating Better Hearing and Speech Month and recognizing the importance of speech-language pathology and audiology services for people with communication and swallowing concerns. We're excited for today. Thank you for joining us.
Right.
Wait one more minute here. So around 12:02 Pacific time, we'll get started.
Right.
We know that everyone's schedule is busy and you have other things that you have to do after this, so we want to be mindful of everyone's time. Thank you for joining us. It's good to see that Godwin is here, joining us all the way from Ghana. So thank you for joining us, Godwin.
Oh, wonderful.
Excited. Hope that this is an interesting webinar and enlightens you about the important, valuable role of the speech-language pathologist, although many names actually for this role: speech-language therapist, speech-language practitioner, speech and language therapist, speech therapist, voice therapist, voice clinician, swallowologist, a physiologist. There's quite a few different words to describe our role, which is interesting in and of itself, isn't it? That we have so many facets to the way that we are working and supporting individuals that we have many names to describe it. Well, I'd love
what we cover today.
Exactly. So welcome, everyone. It's an honor to celebrate a Better Hearing and Speech Month this month of May, and we are excited in doing that to offer this free educational webinar. Music here. Free educational webinar. This webinar is for anyone who seeks a foundational understanding of the role of the speech-language practitioner in supporting communication and swallowing, very important functions. We will discuss the importance of focusing on life participation in particular when supporting people with their communication and swallowing needs, as we offer our clinical perspective on helping people thrive in their lives. I am director, speech-language pathologist, and singing voice specialist at the Wellness Group for Voice, Speech, and Swallowing, an independent practice based in Portland, Oregon, and serving the U.S. West Coast. I've practiced for over 15 years as a voice-specialized speech-language pathologist. I am also founding director and president of Bjorn This Way, Inc., our 501c3 nonprofit organization established with a generous donation to fund speech pathology services for individuals in need. I'm excited to be joined by my colleague, Jennifer Gill.
Hello, hello. Good morning and good afternoon. Thank you so much for joining us today. I too am. So I'm Jennifer Gill. I'm a licensed speech-language pathologist and co-director of the Wellness Group. I realize it is lunchtime in the Pacific time, so just sit back, make yourself comfortable. We did opt to turn screens off and muted, but we really strongly encourage, if anyone has questions, we'd like this to be engaging and interactive. Use the chat box on the bottom of the panel here in Zoom to please type in your questions. We titled today's webinar, Helping People Thrive, because that is what we strive to do from our little corner of the healthcare world. And today we have 45 minutes allowed to us to share with you about what a speech-language pathologist does, who we are, and talk a little bit about our charity foundation. And like I said, we certainly want to allow for a little time for questions at the end. So we wanted to start with, so what is Bjorn Inc., Bjorn This Way Inc.? It's our 501c3 public tax-exempt charity that was initiated by the family of a client of ours. And the it's to fund services with speech-language practitioners so that people can do many things that we take for granted. like speaking, laughing, swallowing, working, socializing, and living. And our vision is for all people to participate in life as fully as possible. So we do this by focusing on the life activities that matter most to our clients and for which they seek out our support to participate in. We want to also introduce who is Bjorn. We were fortunate to have the pleasure of working with this courageous and patient and determined young man. For a number of reasons, Bjorn struggled with speech and communication throughout his life. And I had the pleasure of meeting him about age 20. And he certainly challenged me as a clinician as I was supporting him with specifically finding employment. We were working on interviews and finding a job. And it was exciting to witness his confidence and independence grow as he was gaining tools to better advocate for himself, his communication style, and ultimately voicing his strengths to get a job. Thank you, Bjorn. I'm a better clinician because of you, and now your legacy continues on to support others. I cannot thank him enough. So, why is this important to us? Because communication is a basic human right. For some, it comes easier than for others. And people need access to all possible modes of communication to help fulfill their social, educational, emotional, and vocational goals. And that has been part of a mission of our clinic to help improve access to these services. And Dr. Ziegler will continue to talk about that.
Yeah. One model of healthcare access that we have found very important in helping us create a unique experience for our clients is a healthcare model by Levesque and colleagues, published about in 2013. And in this model, healthcare access is conceptualized as the interface of the needs of the healthcare organizations and individuals who have health concerns, with the ultimate goal of getting healthcare needs met. And this model has served as a wonderful guide for us as we have assessed the most appropriate delivery model for clients in our unique clinical practice setting at the Wellness Group. It consists of 5 important domains: approachability factors that limit healthcare or promote healthcare access, affordability factors, availability factors, acceptability factors, and appropriateness factors. So what does that mean? Well, approachability factors, in this area, we're asking ourselves, does the person know the services exist and understand how speech language pathology services could impact them and help them thrive in their lives and communities? And affordability. Can the person spend the money and time to use the appropriate services that will support them? Acceptability. How do the person's culture and social factors influence their decision to seek care? Availability. Do resources exist in adequate number and proximity so that they can easily access the support they need? And appropriateness. What is the quality of the technical and interpersonal aspects of the service? And is that client empowered? I think that's an important word, empowered, to choose the service and participate fully in treatment decision-making. So you can see how this would be a very important model to consider. And what we have found and what has been published in the research is that there are 2 very key barriers to accessing speech language pathology services in particular. One factor being affordability, that our clients have limited insurance coverage or no insurance coverage, or the benefits of their insurance coverage don't include services with a speech language practitioner. Or there may be high out-of-pocket expenses. Even if they have insurance coverage, there may be a deductible or copays. And so affordability can be an issue for our clients. Approachability is another factor that has limited access to care. And in approachability, the client or patient is unaware of that these services exist that they could benefit from. And if they do know they exist, they don't realize that there's a perceived benefit of engaging in those services. And so as a result of considering these very important factors that were limiting our clients and historically have limited many clients. And of course, we have to acknowledge the disenfranchisement and the unequitable access to care that is a part of a historical and systemic, structural, systematic racism and other hegemonic forces that limit people in being able to access their services. So that's an important piece. And so, with that in mind, it was very important to us, and to me in particular, as somebody who grew up from very humble beginnings, who needed scholarships, who needed grants, who needed help to get to the place where I could be a professional. We have started a charity, a 501c3 charity, called Bjorn This Way Inc., as Jennifer mentioned, with a very generous donation from Bjorn's family. And it was established in September 2021 with the state of Oregon. And then from there, we submitted our application for a tax-exempt status with the IRS so that we could continue to have more funds available to make a bigger impact. And we wanted to be sure people could deduct the donations from their income taxes. And then in June, we received that designation as a 501c3 public charity. In September 2022, we were really excited to start initiating funding of services for qualified folks in need. And to date, here in May 2023, our current impact of funding has been tremendous. We've been able to support 13 applicants and recipients of the funds with a total of 65 sessions, with many of those people already discharged and thriving in their lives. It's been really exciting. And it is a very common problem, actually, to have communication and swallowing disorders. They occur across the lifespan, and they can impact any gender. In fact, probably most people know at least someone who is impacted by communication and swallowing disorders. Maybe someone who struggles to speak with their family, friends, and colleagues because of a stuttering concern. Or maybe someone who isolates themselves because they experience difficulty retrieving the words they want to speak. Or maybe someone who has difficulty swallowing is at risk for aspiration and choking. These are all very real life examples of the very types of clients we have supported, as well as the types of clients that many of our colleagues are supporting and that are needing our support because the consequences of communication disorders are non-trivial. Of course, there is an emotional cost of having a communication and swallowing disorder. People are really impacted emotionally by having these concerns. There's anxiety, frustration, fear, a whole host of emotions. And there's an educational cost. We know that students learn better across the age spectrum. Students learn better when their instructors, when their teachers, when their mentors have a adequate speech and voice, and that are not dysphonic or hoarse. We know that many of our clients are taken out of school, and so they miss opportunities to learn. Many of our clients are also having to miss their employment, and they're not able to work because of their concern, their communication and swallowing concern. And all of this adds up to a staggering cost to society financially. One estimate that is at this point a bit more historical put the cost of communication disorders between $154 billion and $186 billion annually. That's the cost of care, as well as the impact of missing employment or poorer work performance. This is a huge cost and really suggests that this is a significant and important need to address.
Yes, on the tails of that, everyone on this call likely knows someone who has concerns with either their communication or swallowing. And we're learning as speech language pathologists that we continue to need to get the word out, that there are things that people can do to optimize. And so, what is the objective of the speech language pathologist, or the SLP for short? To optimize individuals' ability to communicate and to swallow, and thereby improving quality of life. I want to emphasize again that we want to meet our clients where they are and in the activities that they're wanting to participate in. For example, if we're working with a teacher with a hoarse voice, we don't tell them to stop teaching. We want to empower them with tools to utilize their mechanism in a more efficient way and come up with alternatives to support them, such as amplification while teaching, for example. And so here are some other statistics of speech language pathology. So voicing, there's an estimated 17.9 million US adults ages 18 or older, or 7.6%, that report having had problem with their voice in the past 12 months. So this is very common. And sometimes people just think, oh, this is normal, and so just learning that there are things we can do to prevent and improve. So speaking is another area of our clinical focus. More than 3 million Americans stutter, which can affect individuals of all ages, but does occur most frequently in children ages 2 to 6. And then we look at swallowing statistics. 0.9% of US children ages 3 to 17 have a swallowing disorder that lasted for a week or longer during the past 12 months. I want to also emphasize that speech language pathologists, we work with individuals from infancy all the way through the lifespan. And so swallowing in particular, the prevalence of swallowing concerns is it does increase with age and is something that we frequently work with older adults as well. So, who are these SLPs, and what is their training and background to become a professional? So, we are required to have a master's degree. There are 400 hours of clinical practicum. 375 is direct contact hours. We all have to pass a national praxis examination. And this is in the United States specifically that I'm giving these. There's different criteria around the world. 9 months of supervised clinical fellowship experience. We are required certification both nationally as well as at each state level. You can see clients in other states where you are licensed. So if I see clients in Washington, which I do, I am licensed in Washington as well as Idaho. Dr. Ziegler's licensed in California as well as Oregon. Um, and there's optional additional board certification in areas that you may want to specialize. And certainly continuing education is very important and something that we have a lot of focus on. It's required, for one, for everyone to get continuing education, but it's an opportunity for you to really focus on where you might want to gain those additional education. It keeps us up to date on evidence-based practice that we feel is very important to incorporate into our clinical work, and staying up to date and research as well. We present as well as provide continuing education as well as participate in. And so, as we've talked about some of our scope of practice, there's also a wide variety of clinical settings where you might have come across a speech language pathologist. I think the most well-known is education, early intervention, preschool, K through 12, and colleges and universities, as well as healthcare settings. So we have hospitals, residential, non-residential healthcare facilities, inpatient, outpatient. So the medical setting for sure, and then private practice like ourselves. This can be in many ways to approach private practice as well, with multidisciplinary approaches with an ENT, SLPs, groups. And then there's also corporate organizations that may have a speech language pathologist on staff, such as Google or Intel, having corporate professional communication, having someone on site, as well as local and state and federal government agencies, such as public health departments and uniform services. So a wide range of the scope of settings, and individuals will specialize in certain areas, as we will elaborate on as well. Go ahead, Eric.
So with speech language pathologists showing up in many different settings, you can imagine that our scope of practice is quite wide and encompassing. So we have two main areas in our scope of practice: professional practice and service delivery. We at the Wellness Group actually participate in many of throughout our scope of practice. As we are doing today, we're engaging in advocacy and outreach in order to let people know that speech language pathologists exist, that we have a role in managing communication and swallowing disorders as well as differences. So we help people who don't have a disorder, but perhaps they want to work on their communication and enhance it, make it more impactful. We, of course, provide supervision to students and clinical fellows or trainees and others that we mentor. This is part of this. Many speech pathologists engage in this, and we do in particular at the Wellness Group. We do it with having student externs, clinical fellowships, as well as through our educational branch through the Confident Clinician, where we train SLPs. And then, of course, we provide education, and we do that as well through our Confident Clinician Cooperative, where we can offer continuing education units to ASHA members through our courses. So it's really exciting that not only can we offer education and training to the field of speech language pathology, but those who are in the field can then get continuing education credit for it. And that's really important to us because we want to support our fellow speech language pathologists in their growth. We participate in administrative and leadership roles. Speech pathologists are division chiefs, are rehab managers, are directors of clinics, and play important roles in shaping the future of the profession. And we, of course, engage in research. We specifically at the Wellness Group do engage in research. I'm co-developer of a voice therapy approach that has a number of randomized control trials to support it. And we continue to conduct and publish research in the field of speech language pathology. It's important that we continue to grow the corpus of evidence for the therapy and the care that we provide. Then there's the service delivery aspect of our practice. And that's really in the clinical domain, where we are collaborating with other providers in multidisciplinary or interdisciplinary care. As voice specialized speech language pathologists, we find ourselves collaborating with laryngologists, pulmonologists, gastroenterologists, neurologists, a wide range of healthcare professionals, psychologists, massage therapists, physical therapists, other allied health professionals. It takes a team, doesn't it, to really help people thrive. We provide counseling. I can think of a number of situations, well, almost every situation, because whether or not somebody is having an emotional issue that is causing their concern, or having communication and swallowing issues, can be very emotional, as I mentioned at the very beginning. And so counseling around the impact of having a communication and swallowing disorder is very integral to helping people thrive and progress towards their goals. Prevention and wellness. Obviously, the most important thing we can do is prevent people from developing any communication and swallowing problems, and many can be prevented. So we provide screening opportunities we just did one for World Voice Day, where we had 8 individuals come for voice screenings, and we were able to identify several of them who need further management from an otolaryngologist and a speech language pathology. So it was really critical for them to be able to identify a need so they can get early care and have much more successful outcomes. Of course, we assess and we treat, and that's an important piece of our work. We help people who come to us with a range of concerns from a range of backgrounds and circumstances, with a range of needs and demands for their communication and swallowing. And we focus on helping them have options and participate in their lives as fully as possible. And sometimes that requires things like modalities, technology, and instrumentation, like an alternative and augmentative communication device that's speech generating if they are not able to generate speech or they aren't able to generate it intelligibly. And then, of course, we work with population and systems, and where we have a role in managing and the improvement of overall health and education of populations, improving the experience of the individuals served, and in some circumstances, reducing the cost of care. That's an important mission for us, is reducing the cost of care. Efficiency is an important goal of ours when treating patients, because people are busy and they have to get back to the lives that they're living, and that we want them to live fully. So, in terms of the actual nuts and bolts of our day, we're preventing, assessing, diagnosing, and treating the full range of differences and disorders of human communication and swallowing in individuals of all ages. And we do this by focusing on a variety of SLP practice areas. So many people come in with a variety of concerns, ranging from what we specialize in, voice, from the general population having voice concerns that develop, for instance, after they get their thyroid removed and develop a vocal fold paralysis or paresis, or difficulty moving the vocal fold, to the performer, the professional singer who is touring the country, touring a region and performing a demanding role. That's our focus in our clinic, although we also support swallowing disorders. So somebody who is maybe having difficulty moving the food from their mouth to their stomach, and it's because of their tongue, for instance, we might support that person. We also support children with fluency issues. So they're somebody who is stuttering or has articulation or speech sound distortions. We run the whole gamut of communication and swallowing, and it's an exciting and vast practice scope that we have. And I think one of the exciting things about our field is that you may start supporting clients in one area, and then throughout your career, you may decide you want to shift focus and support clients with other concerns. And it's wonderful that we can do that in our profession. As I mentioned, for us, well, we will be assessing the person for their capabilities, and noticing and observing any impairments, any structural issues or physiologic deficits. Our focus ultimately in our clinic is, how do we get this person to be able to do all of the things that they've been doing and want to be doing in their lives as it relates to communication and swallowing. So we focus on the activities and the participation of that person. A well-known model and classification system for thinking about one's healthcare needs and their rehabilitation is the International Classification of Functioning, Disability, and Health by the World Health Organization. And activities refer to the execution of a task or action where participation is the involvement in a life situation. And we have here on for you some of the major categories of activities and participation, from very specifically working on communication to thinking about self-care and eating and drinking, the interpersonal interactions and relationships that people engage in. Communication, my background is in acting, and so of course I have performed in Shakespeare plays, and in Shakespeare plays you do often see soliloquies where the character is talking to themselves, or a monologue where the character is talking to somebody else, but for an extended period of time they're the one communicating. And so while that it does exist, we all, we talk about our inner voice or having an inner dialogue. We all do have that, but mainly our communication is with somebody else in a dyad between the listener and the communicator, and that usually happens in a volley where people are going back and forth, sharing the time, interacting and communicating. So those types of relationships may be with strangers. You're going to the store and you're grabbing a food item that you need, and you're going to pay for that and interact with the store clerk. Or maybe it's informal social relationships. So you're going to an event with some colleagues, a conference perhaps, and though you have some formal time in learning, you also have some informal time at social events. Or maybe it's family relationships. So we have all different types of relationships that we make and engage in, and those require all different types of communication. We are constantly shifting and modifying our communication for the person and the context and the needs we have in that situation. There's major life areas where we need to communicate, like work and employment. And of course, we all love and need recreation, and we engage socially and in our community and in our civic life. And communication is an important piece of that, and we help people in those areas as well.
So what does it mean to thrive? To grow or develop well or vigorously, to prosper, flourish, have meaningful life experiences. And I think Aaron just captured that very well in this participation and how important it is to meet everyone, to help them do their best to meet individual needs with individual care and building on strengths. I like to emphasize what are we already doing well, and let's build on that, and then helping them develop tools to achieve their personal goals with communication and swallowing. So a little bit more about who we are as speech language pathologists, and as we discussed, um, many of the scope of practice and all of the different we want. It's important that each individual finds the best speech language pathologist to serve their needs. And one area that we are both certified speech language practitioners. We do both specialize in voice, speech and swallowing, and upper airway are there our areas of expertise. Myself, my background is a professional opera singer. And so certainly specializing in voice was my passion and my love. And um, as we mentioned earlier, that we choose our paths and our scope of expertise. And um, I love working with voice empowering singers to either injured singers, to get them back to baseline and doing what they love to do and what they are paid to do. It might their livelihood and getting them back in the show, as well as we have injured voices that to get back to baseline, but we also enjoy with the professional voice users, for example, optimizing on their technique to do extraordinary things such as singing, acting, corporate presentations. We also work with gender affirming voice and communication to support individuals who want to explore ways to express themselves in a more affirming way that better aligns with their gender. As we mentioned earlier, we have various licenses in the whole West Coast and Idaho. We provide telepractice. We also do in-person. And an important piece of our clinic is providing diagnostic laryngeal imaging, which provides important visual information of the structures, of the mechanism, and possible pathology that this information is very important in guiding best care and therapy moving forward. Um, and it's important to us to support all, to be inclusive and support all individuals. So, to give you more of a picture of some of these individuals that we may support out in the world and actual uh, client examples, I mentioned earlier, like the school teacher, helping optimize voice production and deliver impactful educational content in the classroom. There is a lot of literature out there that discusses how a hoarse voice is very difficult to learn from. And so empowering teachers to do their job in a more effective way. An example would be an older adult with bilateral vocal fold paralysis. So this means that the nerve is not triggering their vocal folds to open and close as we would we would want normally to happen. And so in this particular case, this individual had bilateral, both vocal folds. And so there was very little opening. And so airway and getting this person to be safe with their breathing and swallowing was very important. And it was important to them to also optimize on their voice. And so again, increasing participation in daily life and safety. It may be a child with apraxia of speech. This particular one I'm thinking of, he was smart and his brain was going much faster than apraxia. It refers to the motor speech and that connection of the motor patterns. So he was had difficulty with getting the articulation and the words strung together. And so working on helping him engage with his peers, people around him. He was beginning to get frustrated and needing to be heard and understood. And so helping him connect that better to breath and his articulation. It might be, we talked about gender affirming voice care. It could be a non binary individual with a desire for voice gender congruence to enjoy their voice as they express their authentic self to the world. Again, going back to our slide about it being a human right, to the importance of communication, a basic human right. It could be an older adult post-stroke with speech or swallowing, helping get back into enjoying time with friends, eating meals, communicating, possibly in a new way. We might need to bring in some multimodal communication if depending on where the stroke was and how much it may have impacted speech or swallowing. And we also have the pleasure of working with neurodivergent adults who seeking employment, developing professional and social communication in the workplace and daily life, helping them advocate for how they give and receive information, um, and helping, advocate for themselves. We're in an exciting time of more knowledge about neurodivergence and differences in communication and learning, and helping individuals really optimize on their strengths and how to advocate for their best style of communication. So we want you all to help spread the word to gain this awareness of these. Um, Go ahead, Aaron. Chime it in.
The very important role of the speech language pathologist, and letting people know that we exist, and that specifically that our charity Bjorn This Way, whose mission is to fund speech language pathology services, that our charity exists and that funds are in fact available for SLP care. They would have to be obviously situated in a state in which we are licensed, so Washington, Oregon, California, and Idaho. But there is certainly financial assistance available, and people shouldn't have to have that be a barrier. Cost shouldn't be a barrier to their care.
Along those lines, just to add to that, just encouraging anyone on this call, if you know anyone or even fellow professionals that might work with individuals that you might think could gain from these services, because we've found that often those that need these services the most are the last to find out that they're available, or that they know that there are resources out there financially. And so just continuing to try to get the word out. And this will be recorded, and there will be access to this later as well, if you think of others that may benefit from hearing this today.
Well, contact us if you have any questions, or if you know of anybody who would need our support. We're happy to field any questions or comments. Reach out to us by email, inform us about how we can support any of the people that you know who might need either financial assistance or SLP support. At this time, we're happy to open it up to questions. Seems like we do have a question. And it's thank you. Yes, Colette, thank you for coming, and we're glad that it was helpful to learn more about the ways SLPs can support people. Any questions for us? Yeah, I think
Feel free if you think of anything after the fact, feel free to send an email. We provided that.
Bye-bye, Colette. Thank you.
In the previous
Well, thank you
slide of
for
it.
coming. We really appreciate your time, attention, and hope that you leave with a little bit more of an understanding of the entire scope of speech language pathologists and what they can do to support people to thrive in their lives. Take care, and we look forward to seeing you again soon.
Thank you. Happy Better Speech and Hearing Month.